Hi, I'm Dr. Camille Hoffman. I'm an obstetrician and maternal fetal medicine physician and the consultant to the Prosper team here at the University of Colorado. Since I also do prenatal care and work with perinatal patients as a frontline clinician, I'm here to tell you how easy it is to contact the Prosper team for input regarding your patient's mental health needs if you have any concerns, just need a little support, need connection to resources, or for really all your needs related to perinatal mental health and substance use concerns throughout the state of Colorado.
The benefit of having this resource available is that it increases the confidence and the clinical and medical decision-making of the provider to help prevent negative long-term outcomes for the mother and child.
I think it's that when you call Prosper, they're gonna help you know what's the next step or what are the next step and really walk you through what are those options for your specific patient that you called about in an efficient manner. The Prosper team are a team of psychiatrists, and they know the cadence that prenatal care providers also work under, and those are different. So they really are skilled at taking information that's available throughout the state or taking into consideration national guidelines, literature, data, and giving you in a condensed form what the next steps are. So for screening support, the American College of OBGYN recommends choosing a screener, familiarizing your office with it, and using it consistently at the first prenatal visit, sometime in the third trimester, and at every postpartum visit. The most commonly used screeners are the Edinburgh Postnatal Depression Scale, or EPDS. It has been validated for use in both pregnancy and postpartum, and it's available freely in multiple languages.
It's great that we have people screening. If you get a negative screen and you feel like the mom in front of you really does look depressed or anxious, how do you have a conversation with her where she feels comfortable to talk to you about these issues? We have resources to help you, we have consulting psychiatrists to help you, and we want to hear from you. No question is small, no question is something that you'd be afraid to ask.
It's impossible for healthcare professionals to know everything about everything there is to know in terms of culture and language and relevance. So what we want to do is to create some sort of resource library or repository where they can find those resources. So what are some of the screening measures that are translated and validated mainly for the Latina moms so that they can use those tools that are appropriate and valid for that population. But with the Latina moms, I think that making sure that language, although sometimes it will be a barrier, that there are ways for physicians and healthcare professionals to overcome those barriers and still provide good care and appropriate care for moms.
Within the Black and African American community, there has been a number of challenges with access. Prosper is really seeking to better connect with the population, first of all through building trust and thinking about race concordant care, especially when it's not available, as well as the aspects of cultural humility and starting to challenge trauma that has incurred within the population. My job, we really think about, how do we support our providers in presenting themselves in a way that breaks down some of those barriers, starts to build trust through transparency, and creates a system that creates collaboration and ongoing stronger relationships with our patients.
I'm Sarah Collins, Prosper Senior Resource and Referral Specialist. I help connect providers to consultation, education, and trusted referral resources so you can get the support you need quickly. Whether you have a question about screening, need help identifying next steps, or are looking for patient resources, I can help connect you to the right support.
We are available to take almost real-time consultation calls from OBGYNs, midwives, family practice, and other primary care providers, as well as nurses, doulas, lactation consultants, anyone who's taking care of mothers in the perinatal period. We have psychiatric consultation or peer-to-peer consultation where you can call us about a complex case. We also have free education and training sessions in your site or online or virtual via Zoom.
Guidelines have really expanded the scope of obstetric clinicians in this realm. And what I love about Colorado Prosper is it provides a very practical and easy to utilize tool to actually incorporate the most current guidelines from organizations like ACOG into your everyday practice. Some of my favorite consultations are times where clinicians have identified, because they're doing universal screening and they're finding when their patients are experiencing mental health or substance use conditions. And once they have the results of those screenings, it's not always very clear what the next step is. Sometimes there's a question about the diagnosis. They may have a positive screening result for depression, but they may have other symptoms like trauma-based symptoms, or even a question of periods of mania or hypomania in their past. And it's not clear in those situations what the next step is. I think it's really satisfying to me when I get to help somebody through that process of clarifying the diagnosis or clarifying what can be safely done in the moment and what may need to be clarified over time, either by referral or subsequent visits. When you contact Colorado Prosper, we really join the team that works directly with you to wrap around the patient and really to provide all of the support that you might need in your care of the patient, and to consider what resources might be needed for her to have the holistic care that both of you are looking for.